Joining us now, perfect timing too, Sean Connaughton. Sean was the former transportation director of Virginia, and he's now the president and CEO of VHHA, the Virginia Health and Hospital Association. He's a very well-known name here at the state capitol. And Chap Peterson, Sean Connaughton. Sean and Chap, good to have you on.
Hello, Sean.
Hey, good morning, Chap. Good morning, John. How's everyone?
Sean, we're doing fine. So, look, everybody knows that I have done a 180 on Medicaid expansion, right? I fought Chap Peterson and Dick Saslaw and the governor on it for 3 years. Now I'm in favor of it for a number of reasons that I don't want to go into now for the purposes of time, but I'm in favor of it. But one of the things that is coming up here is originally when McAuliffe presented this, and Republicans like me were saying, well, problem is, when the funding from the federal government starts dropping, 95, it starts at 100%, then it goes to 96, 95, 94, 93, right? Well, if Virginia has to pick that up, that's a big number. And it's going to mean that we have to raise taxes, or teachers can't get pay increases, state troopers have to get cut back. But then the VHHA says, well, we'll go ahead and fund that gap, all right? So that's why we're having you on today, because now Governor McAuliffe put in his budget, and I just want clarity from Sean Connaughton on the funding gap issue.
Sure, John. Well, first off, let me just maybe go back a little bit here and talk about the fact that, obviously we're hoping that this is the year that we take and start to draw down these federal funds to provide coverage for uninsured Virginians. We, in fact, earlier this week unveiled a poll that we did with a very well-known Republican pollster that quite clearly showed there's been a groundswell of support now for taking that federal money. And we specifically put in the poll, do you support expanding Medicaid to support to provide coverage for adults? And we gave them the income limits on it. And it came out to 83% of Virginians across the entire state, and also with a vast majority of Republicans supporting it as well. And I think what you've seen happen over the debates that have occurred in Washington in 2017, now people they now understand what the program is. They now are very concerned about coverage. In fact, it was the number one issue that came out of the Virginia elections in November. And so we're hoping that this year is the year that we can have a serious discussion, and then finally a plan and structure to move forward to take down this federal money and to deal with the uninsured. Regarding this whole issue on how we're going to pay for it in the future, when this issue was first raised, we ended up putting forward to then the governor, and we sent to the entire General Assembly our thoughts about it and how we thought something, if this was necessary, how it should be structured, and laid out conditions. And one of the top conditions was it should not be done in the budget. I mean, this is something that we're talking hundreds of millions of dollars that would end up being provided by the hospitals, that this is not something you just simply put in the budget, and that every year potentially could be changed. And so what we've always said is that we're willing to have this conversation, fully understanding, and I hope all the readers understand, the hospitals made this offer where right now, the way it's been proposed, 100% of the fee, the tax, would be provided by hospitals. But when you look at the benefits, it's only about 36% of the money actually comes back to hospitals. The rest of it goes to pharmaceuticals, medical devices, home aid, individual doctors, and all that. So our big issue is and we're saying this because we're concerned right now. We have in the state code minimum, a floor that says for those who are the providers, like our members, provide health care to individuals in the current Medicaid program, reimbursements for those costs cannot go below 78 cents. every year that's been overridden in the budget. And right now we're at like 71 cents on the dollar. So what we want to do is if this becomes necessary, we're not really, when you look at the savings that's going to accrue to the state by expanding Medicaid, because it would actually, there are several programs that the state currently puts money into that they won't need to put money into anymore because of the federal requirements. That will actually pay for the state match for the next several years if you just move those monies over and use it for the state match. And what we're saying is that, listen, we're prepared to have this conversation, but we need everyone to understand is that this thing needs to be, when the monies are actually needed to be drawn down from the private sector. And then secondly, we need to have a lot of controls and protections to make sure that it doesn't become a tax. And that's what's happened in several other states, actually. They've taken these provider assessments, and then they've turned around and essentially turned them into general funds. And that is not going to help us help anyone.
So Sean Connaughton, president of the Virginia Hospital and Health Association, VHHA, Health and Hospital Association, I'm sorry, with us now. We're in Chap Peterson's office. And so, Sean, what you're saying is you want to go ahead and fund the gap, but the first thing is the state would save money by eliminating programs that were funded because we didn't expand Medicaid, right? So that money would go back. There's a savings right there, right off the bat. But I want to get to this, Chap Peterson, and Sean Connaughton brought this up. The new poll that has come out.
Right.
I mean, the number of Virginians and Republicans now in favor of expanding Medicaid is 87%.
Yeah.
It's off the charts. And it's done by a Republican polling company.
And John, here's one of the things to keep in mind. And look, I'm not a Republican, and so they don't need any advice from me. But let's step backwards 5 years. 5 years ago, I was serving in this same office, and the Republicans held all three statewide offices, AG, LG, and governor.
Right.
They had a 2-to-1 majority in the House of Delegates. They had just won back control of the state Senate. The Republican Party was very strong in the state, okay? Even, it was strong in the state. And that year, 2013, is when we actually passed Medicaid expansion the first time through in the Senate budget, and then it basically got dropped out because there were some concerns over it and cost concerns. And then beginning in 2014, they began sort of this butting heads, which we're entering the 5th year of kind of an impasse on this. And since that time, Republicans have dropped every single statewide race, every single one. And of course, they've lost, a ton of seats in the House of Delegates. They have, every time this has been an issue in a campaign, they have lost the campaign without fail. And I keep wondering, look, at what point do they get the memo? This is not a winning issue. That the idea that we're paying taxes for this, and I have personally written these checks, by the way, to the federal government for the Obama surcharge on your income tax, okay? So I'm not necessarily a fan of that part of it, but for God's sakes, let's at least bring the funds back to Virginia. This is not a winning campaign issue for them. It has been winning for Democrats to simply say, look, this is our tax money. Let's keep it in state. Let's provide health insurance for people that are working. These are working people. These are people with incomes typically between, $25,000 and $50,000 a year, whatever it is, but they're working people. Yes, sometimes maybe they don't have kids, okay? A lot of people don't have kids. Bottom line is we have the ability to cover them, and we're not doing it. And here's the only other comment I'll make, and now I'm having chastised Republicans, I'm going to chastise Democrats a bit. The one person that I thought had the best sort of soundbite for this was John Watkins, the senator from Powhatan. Republican, who talked about, when we talked about Marketplace Virginia, which was using the funding, funneling it through either an insurance or an HMO system, so there is some cost controls, that we're not just throwing money at it. I don't want to say just expanding Medicaid. I call it reimagining Medicaid. Let's think about how we can make Medicaid more responsive, how we can match, clients up with doctors, customers up with doctors, where we have more preventative care, more front-end care, less emergency care, less, specialist care that is unnecessary. So I want it to be not just expansion, but reimagining Medicaid to make it more efficient, more responsive, more customer-friendly. I think it's got to be an entire package. But clearly, until we draw down the federal money, there's just no incentive to do anything.
And
So,
John, can I just throw in there? I mean,
yes.
and Virginia's been a leader in Medicaid managed care. About 90%, I believe it's 90% of the.
It is about
enrollees.
90%. Yeah.
Yep. And when you look at those numbers, I mean, if people point to the increased costs of Medicaid, it's not in those who get, I'm going to say, your normal health care coverage. I think it's about 3/4 of the enrollees in the current program are children and their single parents. Yet they only make up about 25 to 30% of the costs. The real costs that are occurring in the current Medicaid people keep on pointing to the ballooning costs, is in this much smaller population, and that is the disabled, the blind, and the elderly. And so when you do look at who would potentially be brought into the Medicaid, expanded Medicaid program, it would be adults whose costs are going to reflect more like the parents and the single kids than the rising and very, very expensive costs of those who are severely disabled and elderly. And Virginia instead of, unfortunately, in many ways, because of talking points by people who oppose this, have really, brought a very negative connotation to Medicaid in Virginia. And as Chap was pointing out, some of the things that can be done, that have already been done and can be done, particularly if they're, you're looking at ways to ensure that only those who really need this type of care and that it's cost contained. These are the things that can be done this year.
Well, Sean, let me just ask my listeners this question, those that are opposed to either you want to call it reimagining Medicaid or Medicaid expansion, MedX as we call it. It's like, if it was good enough for Mike Pence in Indiana, it's good enough for me in Virginia. I mean, to me, there is no argument here for Trump voters. If you like Mike Pence negotiated an expansion of Medicaid for his state, Indiana, which is the same thing, basically, that Virginia is attempting to do. So if it's good enough for Vice President Mike Pence and Indianans, why isn't it good enough for Virginia? That's my question.
Well, and
can anybody answer that? I mean,
well,
Mike Pence did the same thing.
Now it's over two-thirds
and he's the vice president.
Have taken the money. So
I mean, there was not a more conservative governor in the country than Mike Pence. And what he did in Indiana has proved successful.
Right.
When we were debating this, he had just done it. He negotiated himself. He got involved. He has a similar plan to what you've got on the table right now in Virginia. We didn't know what the results would be. It was still scary. Now the results are in. Indiana's done fine with this program. They've reined in costs. Indianans are happy with it. And then you look at the poll numbers. What was the number of people in favor of it in Virginia, Sean? 87%.
83%.
83%, I'm sorry. 83% of Virginians in favor of it. And who was the polling company that did the poll?
Bulger, Rick Bulger.
Rick Bulger.
But it's a very, all the Republicans use Bulger for their polling here for elections.
Rick Bulger runs a Republican polling company that Republicans hire to do Republican polls. So you can't even go back and say, well, it was a push poll, it was done by. Rick Bulger is a Republican pollster. 83% of Virginians are in favor of it. It was good enough for Mike Pence in Indiana. I don't know why it's not good enough for us, Chap.
Listen, John, I'm preaching to the choir, and there's a lot of back history on this, and ironically, it goes back to when Sean was in the McDonnell administration. I always said when we voted for the 2013 transportation plan, Democrats should have held out to make Medicaid expansion part of that project, and we missed that window. But, at this point, I don't, it's not to me who gets credit for it, because I think, like you said, Republican governors have done this, red states have done this. It's really just a matter of let's just get it done, because it gets tiresome to have it become a debate issue year after year after year, especially when the public has really kind of already moved on it.
I mean, 83% is a big number. You can't get 83%, Sean Connaughton, people to agree on anything, let alone something as polarizing, if you will, as Medicaid expansion. I mean, that is a huge number. And let's not forget, there's the money issue, but then there's the fact that, there are about 400 to 450,000 Virginians that seriously fall in the gap. They're working people. These are working people, all right? They have jobs, many of them 2 or 3 jobs. They fall in the gap. Here's what the gap is. They make too much money to qualify for Medicaid. They make too much money to get the Obama subsidies, the Obamacare subsidies, but they don't make enough money to buy their own insurance. And there's 500,000 people in the state perhaps in that predicament. And it is a predicament, all right? Can't buy it, can't qualify. So what this program does is it bridges the gap for them. Indiana did it in a way that cost did not skyrocket out of control. And I think you very succinctly, Sean Connaughton, articulated today that the gap funding from the hospitals would be there at the time that it was needed. And I think if everybody could just understand that, along with the savings immediately of getting rid of the 2 funded programs that are in place in Virginia because we don't have Medicaid expansion, I think the whole thing just makes sense. To me, as a Republican, there's no more argument for not expanding Medicaid in Virginia. The costs are covered, and if we don't get the money from the federal government, guess what? They're going to send it to Jerry Brown in California. As far as I'm concerned, I can't see an argument for no. I mean, you have to ask yourself as a Trump supporter, do you want the money coming back to you in Virginia, or do you want the federal government sending more money to Governor Moonbeam, who has, got signs on his, as you enter the state that's saying, this is a sanctuary state, MS-13, welcome.
Right.
Either you're going to send the money to him or you're going to send it to us.
Right.
Pick one.
John,
It's
I'm
going
actually,
either way.
this is such a good point. I'm going to use it next week. I'm not going to use it Friday because we don't make floor speeches on Fridays, but I'm going to use that visual with like a Brinks truck rolling rolling across the border, Highway 10 or whatever it is, into L.A. with Virginia taxpayer money.
That's where we're going.
All right.
Jeff Peterson, thank you. Sean Connaughton, thank you very much on the John Fredericks Radio Network, Trucking the Truth. I'll be right back.